You're listening to Astonishing Healthcare, the podcast hosted by Judi Health, focusing on the biggest issues affecting healthcare consumers, benefits plan sponsors, and health plans. We're covering how things truly work or don't in the U.S. healthcare system and pharmaceutical supply chain, and we're doing it in an astonishingly efficient way.
Hello, and thank you for listening to another episode of the Astonishing Healthcare Podcast. This is Justin Venneri, your host, Senior Director of Communications and Content, Judi Health. A while back, Kevin Sundquist joined me in the studio for the story of a pharmacy claim. And then on episode 94, Leah Limsadze and Jake Mulkey joined from our product team to walk us through how unified claims processing evolved from a pharmacy foundation. It's been an amazing 4 years for me, just taking a quick step back, that I've been here, joined CapRx back in May of 2022, and now here 4 years later at Judi Health. You guys both have me beat, but to see how the industry has turned recently based on regulatory and market pressure has been truly incredible. So we're picking up on the evolutionary thread, but following a different journey, the story of a medical claim. And you, Kevin and Leah, are both extremely well positioned to confirm what I'm about to say as we continue to refine or perfect the pharmacy side. Now we've got to move and have immense potential for unified health benefits infrastructure to deploy that. And we're talking about medical claims processing and how to make that more efficient, more accurate, what you guys have been working on. So enough from me, Kevin and Leah. Welcome back to the studio.
Thanks, Justin, for having us. We're really excited to talk about this topic, something that is very clearly near and dear to Leah and I's heart. We do have you beat, but we don't have each other beat. We actually started on the same day back in 2019, so we're both really excited to be here.
Good to be back, Justin.
No kidding. That's awesome. I started the same day as Carissa O'Meara, our events lead, so that's kind of cool. Before we get into the details, Kevin, you've worked on nearly every module inside Judi, from plan management and networks, pricing, formularies, etc. Leah, you've spent the last couple of years bringing medical claim adjudication to life inside the platform. What else do listeners need to know about your backgrounds if they haven't heard the episodes I mentioned? We'll link those in the show notes, of course. Kevin, you want to go first? Tell us a little bit about your background and your role here.
Yeah, I lead the product department, which includes customer success and design, as well as the product managers. As you said, Justin, I've worked on pretty much all the products, specifically focused on pharmacy, starting in commercial adjudication, then moving into all the parts of that, whether it's formulary, network, underwriting, and really focused on building a unified vision for our pharmacy products, right? And then later on, we brought on the Prime Therapeutics book of business, and I took over the entire department. And we've really been focused on building out the next generation of product managers at Judi Health, focused on how do we scale and get to over 100 people in our department today, while also keeping the mission strong. Focus on execution, because that's really what services not just our clients, but also our members. I think the last thing I'll say that's important to note is my job before this, almost 7 years ago, was actually combining medical, pharmacy, and EHR data to create patient profiles. Like, this was my whole job, not just to do that, but also just to tell people how to do it and what values we wanted, right? Did they have an inpatient stay? Did they take a certain drug? How long did they take that drug? There are entire groups and teams of people that do this for their everyday job. And what I think is really exciting about this podcast, but also our mission here at Judi Health, is we're trying to make that easier and just say, well, it should always be connected. There should never be a world in which this data is not already integrated and related to each other. So I'll pass it to Leah.
So one of the most exciting things about getting to work on medical claim adjudication product here has been the fact that I came from the provider side. So prior to Judi Health, I used to work a handful of large health systems here in the New York area. And the folks that I worked with, we were the ones submitting all of these claims to payers, to health insurers. And I saw so much of sort of the headache and the problems and the challenges on that side of the equation. So it's been so fascinating now to be on the other side and build out tools that hopefully make it simpler and easier for providers and members to handle this part of the equation.
And that's why I love talking to you guys so much, because you guys have experience doing this, and then you build these products and tools, and it's based on experience and knowing what the pain points are and solving them. So it's always fun. I always learn something new. Starting off in pharmacy, claim adjudication is obviously real time. It's milliseconds. There's a plan member standing at the pharmacy counter, copay is known, there's a lot of certainty, and they walk out with a medication. Usually, I mean, there can be friction at the counter, but we try to minimize that. Tell me about the story of a medical claim in contrast. Kevin, start us off.
Yeah, I almost like to joke that once you give your insurance card to the front office, you don't really know what happens. You might get a copay, and that copay might be right or it might not be right. It's actually what's printed on your card because some of the systems are so opaque that it's pretty much impossible to charge the member the right amount. Or you go into the hospital and you are having a baby, which is really exciting. But all the services that are associated with that at some point need to be aggregated and billed to the right insurer, right? And whether you have primary insurance or you have a secondary insurance or you're part of some sort of other, marketplace, really, I think it's a little bit confusing because on the pharmacy side, you have one claim for one member. The pharmacist puts in a certain combination of numbers and alphanumeric keys, and they get back exactly what they need to really charge that person at the point of sale. But in medical, it's a lot more complicated than that. Part of that is because of the nature, but part of that is because of the systems that people are working on. Over here at Judi Health, we've kind of said, why can't we make that easier? Why can't we make it easier for a provider to check coverage, not just for the services they're providing, but the drugs they're going to provide afterward? Because as much as if you want to get a person who has high cholesterol and you can identify it, if they aren't taking their medication or doing something after that because the medication is too expensive or because they're not being adherent, there's really nothing that they can do unless they get that member back into the system for them. So really from our side, we have tried to make a system that supports not just the adjudication, but also hopefully a revolution in how benefits should be administered on the medical side, as we've done on the pharmacy side as well.
And then, Leah, you've told the story about launching medical claims processing for our own employee population. That was on January 1st, 2025, and what it was like to wait for that first claim. Walk us through that experience, what it revealed, and what it reveals about the medical system is built the way it is. As Kevin described, there's some opacity, it's not clear, there's some delays. Why does that lag even exist? What are the real consequences for members, providers, and the plan administrators?
So the first problem that I think we face in this arena is that the claim that represents the visit that you just had with your provider often cannot be created right there on the spot when you're having your encounter. Sometimes the systems that are used to actually document your appointment, the clinical notes themselves, are completely different from the systems that are used to create the claim itself. So you can imagine that the electronic health record and the billing system could be two completely different systems. So that introduces some natural steps that need to be taken. Some encounters, right, like Kevin alluded to, the birth of a baby, right, can be really complicated and can require some human intervention to code appropriately so that the bill, when it does reach your health insurance provider, is accurate. So there's both human intervention and sometimes multiple systems involved to create a claim out of what was just your visit with the doctor. Every one of those skips, right, introduces lag. Every one of those integrations introduces opportunities for errors. The second problem is that the way that we get that claim, once it's actually eventually formed by some sort of billing software, getting that claim to the right payer is also really challenging. In pharmacy, right, we talk a lot about the switch. The switch very successfully and very quickly routes claims from pharmacies to the right pharmacy benefits manager. But on the medical side, that journey can be a lot more complicated and a lot more variable because there are a number of different clearinghouse providers that are that connector between the EMR and the payers. Some payers also want to ingest these claims directly. Claims can be submitted on paper, which, good luck at that point. It gets mailed somewhere and fingers crossed that it makes it to the right location once it's been received. So each one of those complexities also introduces a bunch of lag. I'm sure you've experienced this before. I remember getting an EOB for one of my labs, I want to say 6 months after the fact, and it was a simple claim, but the problem was that they had my old insurance on file, and it took them 6 months to figure out that they should be billing my new insurance. And that's painful and awful for that laboratory provider who had to go through that experience. And annoying, I'm sure, for my plan sponsor and me, that it took 6 months to get that information back to me.
And the explanation of benefits, or EOB, is the trigger that alerts you to the problem. Great, right?
Exactly. I had no idea. I assumed the claim was well and done and paid for until that moment.
And Kevin, maybe talk to us a little bit about what happens once that claim does arrive.
Yeah, so when the claim comes from typically the EHR has some software within it that takes all the different diagnoses and items that that person went through on the day and it submits it directly to, for us, we use a network, right? In the future, we hope to actually have it directly come to us from that provider as well, maybe directly through the EHR itself. The network then runs through their pricing, their access, as well as if there's any prior authorization that was needed for potentially a larger surgery or procedure. And then that claim actually gets sent to us in a standardized format once a day, right? Talk about real time, even a day. If you're talking about lags and things that are people doing, it's very common that we'll actually get the pharmacy claim well in advance of the medical claim that generated it, which is very interesting to think about from a perspective of trying to do automated prior authorizations on the pharmacy side. So then once we get that claim, to your point, Justin, it goes through the benefit and we will either price it additionally using our own logic, or we will assign a copay, assign coverage, count the number of times that they've seen, let's say, a physical therapist or something along those lines to make sure the member's still covered. And then we will send them out communication through not just our product tools, but also a letter. There are regulations here. We all would like to get rid of letters, but let's focus on getting rid of the fax machines first. From there, it starts the member journey of the member payment and the medical provider payment. And we're going to talk about it a little more in depth, just high level, right? Someone has to pay that doctor, not just the member, because the plan still covers a portion of it, assuming the member's not in their full deductible phase. And then on the member side, the member might have an HSA. So they want to use those dollars. So how do you integrate those dollars and how it's paid? And then you go on to paying the provider, and are you using a software that does that? So all these different things, to Leah's point, not even just the lag of the insurer getting the claim. Talk about the lag to the plan sponsor of, hey, not only did I get the claim and your member is getting a letter in the mail, that provider needs to be paid. And then the member needs to go and pay their copay. And then the doctor's office needs to hound them. So, we're talking about delays on delays, but also just for that member to pay their copay. To Lee's point about the provider side, they're very frustrated because they're not getting paid by the insurer, who has honestly a relatively low incentive to pay them because those dollars are helpful to them. But then also the member, they have the complete shifted responsibility to go and collect from that member. And they actually have collection agencies that the providers farm out because it's just such a burden for those offices. So just high level from a story of a medical claim, it's more about the odyssey of a medical claim, I would like to call it, not just the story from that side.
So Kevin walked you through beginning to end the life cycle of a claim. The other awful complication in the medical sphere is that it is very common to carve all of those steps up and share them among different platforms and potentially different vendors. So I'll give you an example. It's common to carve out the determination of, is this provider in network or not? And if they are a network, what price should they be paid for this claim out to one entity? And then carve out the pricing of out-of-network claims to a different entity, carve out the handling of any prior authorization requests and those decisions to somebody else entirely, and then carve out the actual application of the benefit itself, right? We talk about deductibles, copays, cost sharing, right? What's covered and what's not to somebody else. So one of the things that we are hoping to solve with Judi is bring all of those capabilities into a single system. So you don't have to carve this entire long journey up into 5 more pieces and have to handle all of those integrations and all of that slowdown.
So I have so many questions now. Before I jump ahead, what does it mean for plan sponsors or plan administrators and benefits brokers and consultants that deal in health benefits? Judi, our platform, was designed for that complexity, Leah, so that you have all these disparate things, but now you can pull them together into one. And not to be too rah-rah, I know it's kind of a shameless plug for Judi, but still, just it seems intuitive. And I'm wondering how that works in Judi for medical claims to address all that complexity and the way things have been carved up to pull them back together.
Yeah, so I'll say first, our architecture gives plan sponsors, brokers, consultants, whoever else involved, the flexibility to, if they want to, carve out any part of that equation, to carve it out to whoever they prefer. We're not prescriptive and we work with entity X, entity Y. We'll work with whoever you need us to work with if you find that those folks are giving you the most value. So that's number one. And then number two, we talk about this a lot on the pharmacy side as well, right? Judi's inherent flexibility allows us to enact creative plan designs in a way that other systems are just a little bit too rigid. for, frankly. We've heard from one of our clients that the system that they're relying on today only lets them set up a certain number, what we'll call frequency limits, right? So it's common to say something like, we'll cover physical therapy for you, but only a certain number of visits. And we'll cover chiropractic care for you, but only up to a certain number of visits there as well. Some systems will only let you set up one of those and not both, which means that every single, say you utilize your one limit that you can set up on physical therapy, that means you have to manually adjudicate every single chiropractic claim to ensure that you're counting correctly the number of visits that have been utilized and how many remain. That kind of manual inefficiency is just beyond unnecessary and something that Judi does not artificially create.
Got it. I can see how that would be painful. It seems like if you have a larger population too, and you want to offer richer benefits, you might offer PT or you might offer chiropractic coverage. And if you can't very easily set these things up, I would assume that the other things that come with that, like copays for these things or otherwise, are also complex unnecessarily.
Absolutely. Calculating copays accurately, we came across a plan sponsor who wanted to configure a particular deductible, and their software did not allow them to configure that deductible because it had to be a multiple of something else. So again, this was an appropriate deductible. It was compliant with the plan structure that they wanted to have in place, but because of the system limitations of their tool, they had to raise it a couple $100s for, again, completely unnecessary reasons.
That's wild. Kevin, talk to me about some other new things we've been building, new modules, new features, payments, anything else going on that you can share? No trade secrets.
Yeah. From the product side, we're always trying to think of what's the next best thing, right? Whether that's something we're hearing about in the market or that's something that we're actually outsourcing today, right? How do we bring that into our system? Because instead of just saying, oh, this vendor is good enough, even if they're doing a great job, we want it in our product ourselves for our customers and also just to continue the integration. A really good example is payments. At the start of this year, we actually started using our own product to pay providers. They have to use our provider portal to sign up to get paid through our own system. And then we collect the dollars first before we pay the providers from the plan sponsor. And then we send those out, right? Which really allows us to reduce those who are touching the dollars. So from our side, we can control the fees. We can control the exposure of the plan sponsor from that perspective, whether it's for FWA purposes, whether it's for real-time reversals and readjudication. So really owning that has been something that we were really excited to launch and continue to expand throughout this year. Another area that I'm really excited that we're investing in is integrated care management and FWA. So from our side, we're really trying to go back to unification. Unification is really, really great for adjudication, but back to the point about plan sponsors, well, what are you doing for me, right? What are we building, right? So we're building products that make it easier to track members who are going to start hitting, let's say, stop loss measures. Members who they have their diabetes medications that they're taking, but have they gone to the doctor recently, right? Or did they have an inpatient visit? So building out a unified care management, case management platform is something that we continue to expand on and build to support our clinical programs and our positioning in the market as well. Another area that we continue to expand on is payment integrity, right? Starting in pharmacy and using our quote unquote chops there, but then expanding into medical claims, right? And trying to understand how we ensure that we are paying not only the right rates, but appropriate, right, compared to the rest of the industry, right? And this is a really exciting area that we're using AI to help us build the next generation model. So those are just a couple, right? I could go on and on about the other areas that we're expanding in medical and the network enhancements that we're building out, but I think those are the top three that I'd love to shout out. How could I forget our member tools, right? Like, I think really, and I've told the story a few times, but back in 2025, we actually purchased a company, medical care navigation provider called Amino. And that really kicked off what I would call the member experience revolution here at Judi Health. So over the last year and really launching on 6/15, which shout out to the team, they did a really, really great job. It was a holistic effort across the product development and our operational partners is to reimagine what the member tools look like, continue to build on that and use not just our pharmacy background, but now our medical to create the first unified member experience module, tracking all the different pieces of that benefit for the member and then integrating it with care navigation so that we really, if we're talking about the story of a claim, I think the last time I was on, I said the start of a claim always is someone making the public health positive choice of going to the doctor. Well, how do we be a part of that? And that's where care navigation, I think, is really exciting for us, is we're helping helping you choose the best doctor to go to or the one who's in network. No surprise billing, high quality providers, and a real and accurate estimation of what your cost is going to be based on where you are in your accumulators, what network that doctor is in, and honestly, the day that you're going to go see them, right? And then trying to front load some of those features as well of like, hey, this doctor prescribes X, Y, and Z medication. Make sure that they submit documentation if there's going to be a PA. And then also integrating that with potentially our EHR experiences as well, where we could bring in your actual lab values from the EHR system or any allergies or chart notes that have been diagnosed, and then wrapping that all with our AI virtual advocate product. That's a little bit more in the future, but we are driving there as quickly as possible and trying to integrate all of the great information and backend that we've been building all of these years to really bring it forward to the member.
That's a great transition. Thanks, Kevin. Leah, can you share just a little bit about, I think the technology really helps in two ways. One, inform members of what's going on. Like I know we have like real-time PA for pharmacy. They can see what's happening with the submission there, but also in our member center, our contact center. Give a shout out to Will's team, the award-winning contact center, and how they take care of members. What do these advancements and these new features and modules mean practically for the member experience, when they call us or interact with our tools?
Yeah, let me speak a little bit to the tools we've been creating for our customer care team so that when a provider, a member, anybody calls in, they can give clear, more confident information. I'm sure all of us have had the experience of calling your health insurance plan and trying to figure out what is something going to cost ahead of time? Is it going to be covered? These are hard questions to answer, and I appreciate that way more now that we've built the entire system. It's often kind of impossible to answer, frankly, right? Because if you think about it, a single medical claim has really hundreds of data points on it, but fundamentally, I think you would need at least 20 of those to really, really confidently answer that question. And nobody has 20 data elements available when they are just trying to figure out, right, what is this procedure going to cost me if I get it here? We recently released a new tool for our customer care team where they can plug in just a single procedure code and get back kind of our best guess, right? Given the plan benefit structure, given all of the mappings, what could the coverage for that individual procedure code look like for that plan? For that member. And we call out maybe in certain scenarios that procedure could be considered preventive, right? If maybe other kinds of demographic or frequency or diagnosis code criteria are met, we call out if that procedure code is one that's affected by some of the limits that might be in place based on the plan benefit itself. So we're hoping that things like this will help our customer care team offer more informed guidance to pay members and providers as they call in to seek some of this help. Additionally, right, we've talked a lot about how bringing together pharmacy and medical, bringing together all of the attributes that we know about a member gives our customer care team an additional insight into, frankly, everything that could possibly be going on, which is a really, really powerful part of servicing our unified members instead of addressing these pharmacy questions in isolation from medical, right, or whatever it may be. You can have insight into the greater picture.
That's awesome. Kevin, I'm going to jump to you on like the provider side too. They feel real friction too, whether it's, having to outsource collections or just have staff available to make calls and follow up on things and just help. Walk us through some of the friction points and how they impact the member, how they impact the relationship, how we're trying to help there.
Yeah, I think from our side, trying to be a partner with the provider has always been our philosophy. What we don't want is this known friction between the insurer and the provider. We spend a lot of time working with pharmacies to make sure that they're reimbursed appropriately using our NADAC model with a higher level of dispensing fee. So on the provider side, we are working with them to be flexible in terms of the networks that they are allowed in, how we're pricing the claims, and like looking at what they've submitted to us and understanding what is a fair reimbursement, but also trying to build tools that are easy to use. And one of the things that we've just gone through is a clear verification on our provider portal so that they don't have to go through any sort of additional MFA procedures. So as we go in and then they have our tools to do all the things at once. Again, we talk about unified, not to say it over and over again, but how do we allow that provider to do all the things they need to do with us in one place? And then how do we scale that software so that it's not just for Judi Health, but also we give that to our other vendors that we're working with? I think one of the things that's really exciting about working here is we are a technology company, and our goal is not to just build the best software for just ourselves. How do we build the best software to change the industry and democratize that so that anyone that wants to work with us can use the products to make the experience for the provider and the member better?
All right, two more questions. You guys have been generous with your time, and I know we've got a lot to do, so you want to get back to work. We'll have you back on for sure, because it's always fun talking to you guys. So I got to ask about AI. Kevin, sorry, I'm going to start with you. Where is AI making the biggest difference, measurable difference today in how claims are processed or prior authorizations handled, or where are we deploying AI effectively? Tell us a little bit about what strides we might be making there.
Yeah, I am always going to harp on facts. So one of the things that we did early on is the ability to take faxes and extract key information to either create prior authorization cases or even actually create medical claims, which is something that's been really exciting for us as well, to kind of build a generalized model that allows us to do that really, what I would describe as complicated and needing of human verification, extraction of data from faxes. And then that has led not just to being able to initiate care, but also evaluate care. So on the prior authorization side on the pharmacy, we actually have AI reading chart notes submitted by the doctor or directly ported over from the EHR system to then answer clinical questions. And now these clinical questions help inform our pharmacists as to what actually the provider has said or never responded to, but also doing verification on that so that our pharmacists are spending more time evaluating the case than hunting down answers and trying to understand the merits of that member's history and the care that they're trying to get based on their benefit design. Because our job is to support the plan and support the members, but we need to make sure that we're always keeping the proper guardrails up. And then obviously everybody has released their voice agent into the customer care center. So we are rapidly driving towards that as well. And then I teased a little bit about where we're going with our member tools as well, but really trying to take an AI first approach to a lot of our newer products, because a lot of these systems that are out there are trying to bolt on AI to these old software systems. But really, when you should be taking the focus of how do I take the newest technology, the infrastructure that we've built in Judi, and make a new experience? Because AI is new, and that's how we should be thinking about it, as opposed to how do I just do what I was doing before, maybe a little bit faster using AI that potentially doesn't have as high of trust. So I think that's from our side where we're taking a real thoughtful approach about how do we tackle the big problems while also remembering that this is people's healthcare, not just a business.
Leah, anything you'd add on that? Other opportunities you see for removing some of the administrative layers through automation, AI?
We'll definitely echo Kevin's mention of our intelligent document processing, the AI tools. The medical realm and dental, frankly, and vision, there's still so much paper being exchanged. I love my dentist. My dentist is the best. I thought, was extremely tech forward. And then my first dental appointment after starting this work, I watched him print off my dental claim and put it into an envelope right in front of me. And I was sad because like, oh my God, I'm part of the problem. I'm part of the problem. Somebody's going to have to, go transcribe this paper claim into some piece of software. Just awful to think about in the 21st century. So all of the work that we're doing there is going to be, I think, extremely impactful. We see a lot of claims, frankly, with transcription errors today, with just like a provider's name will come across to us as unintelligible. Anyway, I won't harp on that any further, but that will be an extreme time saving and data improvement for all of us once we can get that bolted in everywhere across the system.
Yeah, it's always funny how we look at things differently given the work you do, depending on how invested you are in it, right? You're like, wow, I'm part of the problem because my dentist printed off a paper claim. Last question, as always, I've got to ask, and please keep your compliance hats on, of course. Most astonishing thing you've seen that's safe to share related to the conversation here today. Leah, I'll stick with you. You want to go first?
Yeah, this is sort of perhaps bad astonishing, but astonished me nonetheless. We were recently speaking with another third-party administrator, TPA, that manages medical benefits, and they shared that the system they currently rely on to adjudicate their claims gets member cost share calculations right only 80% of the time. Coming, of course, from our pharmacy benefits background, that is crazy to think about. The 20% of the time, your copay could just be wrong. So I will say it's a good reminder of the kinds of challenges that folks have with the tools that they have and how closing that gap is going to be a big win for everybody involved.
Oh, I like that. It's a definitely win-win-win situation. Kevin, send us off. Tell us from the most astonishing thing you've seen or heard related to the conversation we're having here today about the medical claims processing.
I had one, Justin, I was going to say, but I was thinking about what, as Leah was saying it, and What I think the most astonishing thing that I've experienced since the last podcast, or honestly in my time here, is we were talking with one of these TPAs. And if you don't know, there are I think thousands of TPAs, right? These are the individuals that process your medical claims. And they were talking about Judi and they're like, oh, this is really, really great. I wonder if we should go into pharmacy too. And I'm sitting here and I'm like, that's happening. The democratization of not just medical, but now removing the barriers to allowing competition in the market for PBM is something that we've always talked about. There shouldn't just be the big three. Honestly, there shouldn't be 10. There should be many and many of these different PBMs and entities that are out there. And if we are building the infrastructure to make TPAs start saying, you know what, maybe we should be doing pharmacy too, right? I mean, obviously that's good for us, but I think that's good for the market. And I think it's good for us as members, as parents, as citizens, right? I think it's really, really something that has been astonishing to me.
Well, thank you both for taking the time today. Appreciate you joining us again on the show, and we look forward to hopefully having you back and talking about more developments, more modules, more features of Judi, and hopefully more progress. Have a great rest of your day.
Thanks.
Thank you for listening to Astonishing Healthcare. Head over to judi.health and visit the Insights section for show notes and other relevant content. If you like this episode, be sure to subscribe so you don't miss the next one. And definitely share the link to this show with your network. Have a great rest of your day.